Healthy Hampton Roads is sponsored by Secours.
We're talking about hernias with Dr. Yassar Youssef from Secours. Thank you so much for joining us.
Thank you.
And I guess the place to start is to let people know what a hernia actually is.
Sure. A hernia is a bulge or a defect in the abdominal wall or the groin through which an organ or tissue can protrude. It usually can be present at birth, but most of the time is acquired during life.
And either way, somebody probably should do something about a hernia sooner rather than later.
Sure. Some hernia are asymptomatic, but most are symptomatic, and you want to try to repair them before they become symptomatic because of the concern of bowel obstruction or injury into the abdomen, and then it will make that surgery even more difficult.
All right, so don't wait until it could become complicated, and there have been advances in robotics, minimally invasive surgery, and minimal risk of infection too. So all those reasons someone may be nervous, they should not be, and seek more information. For more on hernia treatment and repair options, you can visit bonsecours.com.